Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic is, what is the best treatment for spinal stenosis? What is spinal stenosis? It represents a narrowing of the spinal canal and pinching of nerve roots. Usually it's due to bony and soft tissue overgrowth from arthritis. It usually occurs in patients over the age of 50, and it's often seen at multiple levels, and it is not necessarily symmetric. Here's a cartoon showing a normal spinal canal. You have the disc here, spinal canal with spinal cord wide open. Okay. When you start to get arthritis and bony and soft tissue overgrowth, you can pinch on the spinal canal and hit nerve roots. The symptoms that represent typically aching pain in the buttock and the legs on the affected side. May have symptoms of sciatica, and in unusual cases, patients can have leg weakness. It may actually be mistaken for a hip joint problem if the pain goes down the thigh and also into the groin. Symptoms usually are typically position related. Leaning forward feels better as it frees up the nerve roots, so patients will often say, I actually feel better when I'm in the grocery store leaning forward on the shopping cart, or while they're walking upstairs, you're sort of leaning forward, and when you're walking downstairs, you're sort of leaning backward. That can increase your pain. There's a difference between neurogenic claudication versus vascular claudication. Vascular claudication usually starts with pain in the calf and moves up the leg. Okay, that's due to blood flow issues. Neurogenic claudication from spinal stenosis usually starts proximally, like around the hip, and then goes down a bit, and it's position related. It's not necessarily effort related like vascular claudication. Patients will say, my calves really start hurting me after about 50 yards of walking. That is more common with peripheral vascular disease. In reality, most people with spinal stenosis actually have no symptoms. They may be very bad on an MRI, but they may not hurt at all. If they do, though, treatment options include initially over-the-counter anti-inflammatories and Tylenol. Neurontin and Lyrica have shown to work well for spinal stenosis. Physical therapy, spinal decompression therapy, which is intermittent computerized traction, can work well. And then the gold standard for years has been epidural steroid injections. Here you actually see a caudal injection. There's the lumbar spine, the sacrum. This opening is called the sacral hiatus. And for a caudal epidural injection, a pain doctor will inject a large amount of steroid and numbing medicine through the sacral hiatus. That medicine can migrate up and provide soothing pain relief to several areas of nerve root pinching. So whether or not to have surgery for spinal stenosis is a quality of life decision. It should only be made after considerable conservative treatments fail. A typical surgery is called a lumbar laminectomy, but over 90% of patients who have spinal stenosis won't need surgery. If you do have a surgical decision, like I said, it's a lumbar laminectomy. It's done under general anesthesia. It's usually a 1-hour procedure. Typically, a fusion is not necessary. It's a low-risk procedure, but it is surgery. 50% of those who have a laminectomy without a fusion end up with some stiffness post-operatively. There's also a chance of post-laminectomy syndrome. So if you have a decompression and these nerve roots are freed up, there's a small chance of getting scar tissue around one of these nerve roots or several, and you can end up with significant leg pain. The bottom line is that over 9% of the time, surgery can be avoided. Epidural injections can be done as a series, 3 over 6 weeks, and then it can be repeated every few months. It's a quality of life decision. Spinal fusion, if that's added to laminectomy, it adds a whole level of complexity to the procedure. The top non-operative pain management in New Jersey is through the New Jersey Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online today at newjerseypainnetwork.com and then call us for more information and scheduling at 844-2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.